Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Diarrhea. Introduction. Diarrhea means that you have loose, watery stools more than 3 times in one day. You may also have cramps, nausea, and an urgent need to have a bowel movement. Although usually not harmful, diarrhea can become dangerous or signal a more serious problem. There are many causes of diarrhea. In many cases, no cause can be found. This program explains the causes and symptoms of diarrhea. It also talks about the health complications caused by diarrhea. Information on treatment and prevention is also included. Diarrhea. Stools contain what is left after your digestive system absorbs nutrients and fluids from what you eat and drink. Normal bowel function can vary from 3 bowel movements per day to 3 per week. A bowel movement is considered normal if it contains no blood, is easily passed without pain or cramping, is well formed. Stools will be loose and watery if your body does not absorb the fluids. Loose stools can also happen if your digestive system produces extra fluids. Loose stools contain more water, salts, and minerals and way more than solid stools. Diarrhea is when a person has frequent loose and watery bowel movements. Diarrhea that lasts a short time is called acute diarrhea. Acute diarrhea is a common problem. It usually lasts only 1 or 2 days, but it may last longer. Diarrhea that lasts for at least 4 weeks is called chronic diarrhea. Symptoms and complications. The main symptom of diarrhea is passing frequent loose stools. Other possible symptoms of diarrhea include an urgent need to use the bathroom, cramps or pain in the abdomen, loss of bowel control. If a virus or bacterium is the cause of your diarrhea, you may have bloody stools, chills, fever. When you have diarrhea, you may feel sick to your stomach or become dehydrated. A person becomes dehydrated when the body loses a large amount of fluids. Dehydration is a dangerous complication of diarrhea. Fluids play an important role in the body. If there are not enough of them, the body cannot work properly. Every time you have a bowel movement, you lose fluids. Diarrhea causes you to lose even more fluids. You also lose salts and minerals, such as sodium, chloride, and potassium. These salts and minerals affect the amount of water that stays in your body. Dehydration can be serious, especially for children and older adults. It can also be serious for people with weakened immune systems. Signs of dehydration in adults are being thirsty, feeling dizzy or fainting, feeling tired, having dark-colored urine, having dry skin, urinating less often than usual. Signs of dehydration in babies and young children are being more cranky or drowsy than usual, crying without tears, having a dry mouth and tongue, having a high fever, having no wet diapers for 3 hours or more, having sunken eyes, cheeks, or soft spot in the skull. Also, you can check to see if a person is dehydrated by gently pinching his or her skin. When people are dehydrated, their skin does not flatten back to normal right away after being released. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. When to see a healthcare provider. Diarrhea often goes away by itself, but it can be a sign of a more serious problem. You should see a healthcare provider if you have any of the following symptoms. A fever of 102 degrees Fahrenheit or higher. Diarrhea for more than 2 days in adults or more than 24 hours in children. Signs of dehydration. Also see a healthcare provider if you have severe pain in your abdomen or rectum, stools containing blood or pus, stools that are black and tarry. If your child has diarrhea, do not hesitate to call a healthcare provider for advice. Diarrhea can be dangerous in children. Causes. Causes of diarrhea include bacteria from contaminated food or water, viruses that cause illnesses such as the flu, parasites, which are tiny organisms found in contaminated food or water, medicines such as antibiotics. Traveler's diarrhea is the name given to diarrhea caused by eating contaminated food or drinking contaminated water. It may happen when you visit a place where the climate, social practices, or sanitary standards differ from yours at home. Rotavirus is the most common cause of diarrhea in infants and children worldwide. It spreads easily through hand-to-mouth contact. People can spread rotavirus by not washing their hands properly after changing a diaper. There is a vaccine to help prevent against this viral infection. Diarrhea can also be caused by diseases that affect the stomach, small intestine, or colon, problems digesting certain foods, problems with how the colon works. Sometimes no cause can be found. As long as diarrhea goes away within 1 to 2 days, finding the cause is not usually necessary. Diagnosis. To find the cause of diarrhea, your healthcare provider will perform a physical exam. He or she will also ask you about any medications you are taking, recent vacations you have taken, your diet. Your healthcare provider may test your stool or blood. This is done to look for bacteria, parasites, or other signs of disease or infection. If you have chronic diarrhea that lasts for more than 4 weeks, your healthcare provider may perform other tests. Stool cultures may be used to test for bacteria, parasites, or viruses. 3 or more stool samples may be required for a stool culture. Special tests may be needed to diagnose some parasites known to cause chronic diarrhea. If these tests do not reveal the cause of the diarrhea, additional tests may be done. These include X-rays and an endoscopy. Treatment. The diarrhea will usually go away on its own, but until it does, it is important to get plenty of fluids. This helps your body work properly. Taking medicine to stop diarrhea can be helpful in some cases. Some of these medicines are available over the counter without a prescription. Stop taking these medicines if symptoms get worse or if the diarrhea lasts more than 2 days. If you have bloody diarrhea, you should not use over-the-counter diarrhea medicines. These medicines may make diarrhea last longer. A healthcare provider will usually prescribe antibiotics instead. Over-the-counter medicines for diarrhea may be dangerous for babies and children. Talk with a healthcare provider before giving your child these medicines. Special hydrating formulas are available to treat dehydration caused by diarrhea. These drinks contain the important minerals your body loses during a case of diarrhea. Talk to a healthcare provider or a pharmacist to learn more about using these drinks. Prevention. 2 types of diarrhea can be prevented: rotavirus diarrhea and traveler's diarrhea.
Rotatec and Rotarix are vaccines used in many countries to protect against rotavirus. Rotavirus is the common virus that causes diarrhea in babies and children. These vaccines may be given to your baby within a few weeks to a few months after birth. To learn more about rotavirus vaccines, talk with your child's healthcare provider.
Rotatec and Rotarix only prevent diarrhea caused by rotavirus. Children who have been vaccinated may still get diarrhea from another cause. People may develop traveler's diarrhea while visiting developing areas of the world. These places may not have set standards for properly cleaning, preparing, or handling food and water. To help prevent traveler's diarrhea, follow these suggestions. Do not drink tap water. Do not use tap water to brush your teeth, and do not use ice cubes made from tap water. Do not eat or drink unpasteurized milk or milk products. Do not eat raw fruits and vegetables unless they can be peeled and you peel them. Do not eat raw or rare meat and fish. Do not eat meat or shellfish that is not hot when served. Do not eat food sold by street vendors. You can drink bottled water, carbonated soft drinks, and hot drinks such as coffee and tea. Before traveling outside of your country, talk with your healthcare provider. Your healthcare provider may suggest taking medicine with you. In some cases, taking antibiotics before traveling can help prevent travelers' diarrhea. Early treatment with antibiotics can shorten an episode of travelers' diarrhea. Proper hand washing can prevent the spread of diarrhea. Always wash your hands after using the toilet or changing a diaper. Also, wash your hands before and after handling food.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Diarrhea is loose, watery bowel movements that happen more than 3 times in one day. Acute diarrhea is a common problem. It usually lasts only 1 or 2 days, but it may last longer. Dehydration is a common complication of diarrhea. Being dehydrated means your body does not have enough fluid to work properly. Dehydration can be serious, especially for children, older adults, and people with weakened immune systems. Diarrhea is treated and dehydration is prevented by replacing lost fluids, salts, and minerals. See your healthcare provider if you have a fever of 102 degrees Fahrenheit or higher, diarrhea that lasts more than 2 days, severe pain in your abdomen or rectum, signs of dehydration, stools containing blood or pus, stools that are black and tarry. Take your child to a healthcare provider right away if your child has diarrhea for more than 24 hours, signs of dehydration, stools containing blood or pus, stools that are black and tarry. You can also contact a healthcare provider for advice when your child gets diarrhea. Diarrhea in children can be dangerous. 2 types of diarrhea can be prevented: rotavirus diarrhea and traveler's diarrhea. Talk to your healthcare provider about available vaccines for your child and how to prevent diarrhea if you are traveling.
Thank you for using Explain.